Hopefully everybody can hear me all right. Good. If anybody does have any technical issues or for some reason can't hear me, please type into the chat box and we will try and get that situated for you. Turn up the volume a bit. All right, so hopefully everybody was able to get the email I sent earlier today with the handouts and the slides for this presentation. And I will be referencing those slides as we go along. Tonight, we are talking about Medicare and other types of health insurance options that might be available. I will be pausing at the end of each section of this presentation to give people a chance to answer or ask questions. You can ask questions at that point by either texting in or typing into the chat box, and I will address questions in the chat, or you're welcome to unmute yourself and ask your question at that time as well. Looks like we still got people straggling in, but we will go ahead and get started because I don't want to keep you guys here too long. So again, good evening. Hope you've had a good day. My name is Roma. I'm with the Area Agency on Aging, and this is part 4 of 4, Medicare 101, Medicare and other health insurance options. So let's get started. Again, briefly, I am with the Area Agency on Aging through the Pikes Peak Area Council of Governments, and the mission of the Area Agency on Aging is to coordinate and develop systems that are designed to remove barriers to independent living so that people can stay in their homes for as long as possible in the community. This is in partnership with the Pikes Peak Library District. We've had a wonderful partnership with our library district for several years now in offering these Medicare 101 presentations. Obviously, hopefully everybody's familiar with the library district that has 15 facilities in the Pikes Peak area, and as well as mobile libraries. We are very proud to partner with the library district, and they are very accommodating to us for these presentations. I am also with the SHIP program, or the State Health Insurance Counseling Program. This is a federally funded program that is designed solely and specifically to provide free, unbiased assistance, education, and counseling in all things Medicare and all things related to Medicare, such as long-term care insurance, Medicaid, financial assistance programs, as well as supplements and advantage plans and Medicare Part D. The Pikes Peak Area Agency on Aging SHIP program serves 9 counties in Colorado, and I have provided both our local phone number as well as the statewide toll-free number that will route people to the SHIP office closest to where they're calling from. There is a SHIP program or a SHIP counselor available in every county of every state in this country to provide counseling and education at no cost. Quick review of what we've talked about so far. Our first week, we talked about Medicare eligibility and the basics of Medicare Parts A and B. The second week, we talked about options to go with Medicare A and B, such as Medigap or Medicare supplements and Medicare Advantage plans, sometimes also referred to as Medicare Part C. And week number 3, we covered Medicare Part D, D for drugs, the prescription drug benefit of Medicare. And so this last week, we are going to cover many of the different types of coverage that might be available for people that is above and beyond everything that we've talked about. We're going to talk about employer coverage, which includes COBRA, retiree coverage. We're going to talk about military coverage for retirees and for veterans. We're going to talk about Medicaid options as well as the marketplace. But we are going to start with employer coverage. So many people these days are obviously working beyond age 65 or initial eligibility into Medicare. And that is usually, employment usually comes or hopefully comes with employer group coverage. And that employer group coverage can cover not only the employee, but potentially the family, the spouse, the children. If someone continues to work beyond age 65 or initial eligibility into Medicare, and they have employer coverage through that active work, you can delay enrollment into any part of Medicare, not just A or B, but any part of Medicare. You can delay enrollment into Medicare based on the fact that you are covered by active employment employer coverage. And when that active employment ends, you would have an extended period of time to enroll in Medicare without penalty. So if you delay enrollment into Medicare based on active employment with employer group health coverage, when that employment ends, you have 8 months from the time that employer coverage ends to actually enroll in Medicare without any penalty. Employers cannot require someone who becomes eligible for Medicare to enroll in Medicare. They cannot take that into consideration. They would have to continue to cover you under the employer group coverage as if Medicare never came into the picture. You can enroll in Medicare and have employer coverage at the same time. And for some people, depending on the type of coverage that they may have through the employer, that might be an advantage to them, depending on how good or how not good that coverage is through the employer. Or it may not be an advantage. And it may simply be you paying premiums for two insurances that aren't necessarily needed. There's a lot of things to take into consideration when you're looking at employer coverage versus Medicare, cost being one of the major factors, what you're paying for the employer coverage versus what you might pay for Medicare, how good that coverage is, as far as, what kind of maximum out of pocket you may have through the employer coverage, what kind of deductibles, what your copays are, what the drug coverage copay costs are. All of those kinds of things you would want to look at and compare those costs to what Medicare costs to offer those same benefits. Again, there could be pros and cons to enrolling in both Medicare A and B and having employer coverage. Many people do decide to enroll in Part A and keep employer coverage because Part A is for most of us at no cost. And there could be an advantage to that for some people. For example, if you have an employer group health plan that has, say, a $5,000 deductible, if you enroll in Medicare Part A and have a hospitalization, which is the main benefit of Medicare Part A, your employer coverage would still be primary in most cases. If you have a hospitalization, your employer coverage would pay first, but probably apply most of that hospitalization towards the $5,000 deductible. Medicare Part A would be secondary coverage to that. That $5,000 deductible would be able to be billed to Medicare Part A, and Medicare Part A very likely would cover the difference between that $5,000 deductible and the Part A deductible, which again is $1,482, I believe, right now. So it could provide some cost payment in a situation like that. But again, you'd want to look closely at the types of coverage that you have with the employer versus the coverage that Medicare provides. Another type of employer coverage that some people might be looking at currently is COBRA coverage. COBRA coverage is basically employer health coverage that is provided in a situation where employment has either ended or employment has been reduced, such as hours have been reduced to where you no longer qualify for employer health coverage. COBRA coverage is an option that is law, so employers have to offer that to you in certain circumstances, which would primarily be when employment ends, but not through termination, or the reduction in hours that causes the loss of your eligibility for the employer health coverage. In that situation, through COBRA, not only would you be able to continue the employer coverage, but you'd also be able to continue to cover your dependents, your spouse or your children. If under certain circumstances, though, COBRA coverage is not allowed to continue. So If you are losing employment, you decide to go on COBRA to continue your health coverage for you and or your family, and then you become eligible for Medicare. Once you become eligible for Medicare, you're no longer eligible for COBRA. However, your dependents would still be eligible to stay on COBRA, even if you are not in a situation like that. So COBRA is typically taken into consideration for employees who have younger spouses or have children that need to continue health coverage through them. COBRA is a good option for that situation. It is a limited benefit. Typically, COBRA coverage can only last for an average of 18 months after employment ends. There are some situations that do allow additional time under COBRA. It typically involves whether or not someone becomes disabled while they're on COBRA or things of that nature. Again, if someone is enrolled in COBRA due to loss of employer coverage and then becomes eligible for Medicare, COBRA eligibility ends and you would have to enroll in Medicare because COBRA would end, but it would continue to cover your spouse or dependents. But if you're already enrolled in Medicare, so say you're working, you have employer coverage, you go ahead and decide to enroll in Medicare at the same time, then you lose your job because you're already enrolled in Medicare, you would be able to take advantage of COBRA in that situation to continue to cover your spouse or dependents as well. So the rules for COBRA can be really kind of complicated. Whether or not someone is eligible for COBRA also depends on the size of the employer. And not only the size of the employer, but the size of the employer determines whether or not COBRA would be primary or Medicare would be primary. The size of the employer is different for people who are on COBRA who are disabled versus people who are not disabled. If someone is entitled to Medicare, again, prior to enrolling in COBRA, you can have both COBRA and Medicare at the same time. However, COBRA would not be considered credible coverage for delay enrollment in Medicare. So if someone chooses when they lose employment and they get onto COBRA, if they choose to stay in COBRA versus enrolling in Medicare when they become eligible, and that COBRA lasts beyond the 8-month window that you're given to enroll in Medicare at the end of employment, you would be subject to penalties and having to wait until the next general enrollment period to get Medicare because COBRA would not be considered credible or good enough coverage to allow that delay in enrollment into Medicare. Again, most people in a situation who are eligible for Medicare do the COBRA so that their dependents and spouses can remain covered. But it certainly is a situation that you have to be very careful about when Medicare becomes involved. And certainly you have to be aware that if COBRA is in place and then you become eligible for Medicare, you're going to lose the COBRA. You need to enroll in Medicare. Any questions about any of that so far? Looks like I do have some questions in the chat. I have a comment. COBRA seems to be very expensive for family plans. So COBRA, the thing with COBRA is when you are actively employed, the employer is typically picking up a large chunk of the cost of that health insurance. And so it's not usually or hopefully very expensive to the employee. However, when that employment ends and you are going to take advantage of being able to continue the health insurance, the full cost of that health insurance becomes your responsibility. So the part that the employer has been paying, the employer will no longer pay and you're responsible for the full premium, which, of course, can be quite expensive. I have a question. Kaylin, I will address your TriCare question in a few minutes, if that's okay. And then I'm not understanding separation agreement issue.
Yeah, I'll just throw this out there for everyone's consideration. I recently, or the company I work for lost a contract with the military, and I'm going to work for the company that won the contract. But
Okay.
my former company wanted me to sign a separation agreement that said I would not enroll in Medicare within 30 months, which I thought was really interesting. And if anybody's interested in the rest of the story, I can tell you later.
I may be interested in the rest of that story because I've never heard that before.
Yeah, apparently it has to do with something called the Medicare Secondary Payer Act or something like that.
Which I'm aware of that rule, but
I'll text you later.
yeah, it might be something we talk, and that very well could be something having to do with the size of the employer. So if your employer was very small, there was only a handful of contracted employees under that contract, that could be the reason that they wouldn't want you to enroll in Medicare. Well, no, even that wouldn't be the good reason, because they would want you to enroll in Medicare to relieve them of having to pay insurance. I don't know, we may have to discuss that in more detail because I've never heard of anyone requiring that kind of agreement. So that is very interesting and not necessarily in a good way. So yeah, if you could email me that, maybe I can get some clarification on that and verify whether or not that's even legal, because that doesn't sound right to me. But again, COBRA rules and regulations are really complex. COBRA insurance is managed by several different government entities. So there are many different fingers in the pot when it comes to how the COBRA benefits are managed and what the rules are that these companies have to follow. So, you know, if there's ever any question about COBRA coverage and how it affects you or your family, you're welcome to give us a call. I did provide a handout in the email I sent earlier that has some good frequently asked questions and some good online references for additional information to the different government entities that manage COBRA. All right, so if there's no other COBRA or employer questions, we will move on. All right, so now we're going to talk about retirement coverage. So you were employed, but you have retired from that employer, and that employer, you're lucky enough that that employer offers health benefits to its retirees. Many times when an employer offers retiree health benefits, they will also offer retiree health benefits that they are arranging to work specifically with Medicare for those retirees that do enroll in Medicare. The thing about retiree coverage is that retiree coverage can vary significantly from employer to employer, because the employers can basically customize the type of coverage that they want to offer their retirees. So it's not a all-in-one, or there's not a standard type of retiree coverage. It very much depends on where you retired from and what kind of coverage that they have chosen to offer their Medicare retirees. However, it's usually something that you would want to take into consideration when you're looking at your options once you are enrolled in Medicare. Many times retiree coverage, because it is specifically or can be specifically designed for the retiree who enrolls in Medicare, can turn out to be very, very good option for coverage to go with Medicare. But it really, again, depends on the employer, because I've seen employer retiree coverage vary from anywhere from just extending the employer coverage and letting it become secondary to Medicare with the same costs to you. I've seen it I've seen employers customize what I consider a standardized supplement so that it perhaps enhances benefits to make them slightly better than a standardized supplement package. I've seen them enhance Advantage Plan benefits. I've seen employers offer flat supplement or Advantage, just the standardized through a third-party, administrator. The things you would want to take into consideration when you're trying to compare retiree coverage options to the options that we've already talked about, such as supplements and Advantage plans. Obviously, cost is going to be a biggie. So cost is always going to be first and foremost for most people. Do you have to pay for that retiree health coverage? What kind of benefits does it provide after Medicare pays their part first? Does it include drug coverage? And is that drug coverage considered credible? Meaning, is that drug coverage considered as good as what Medicare offers under Medicare Part D benefits? In a situation regarding the drug coverage, employers are required to provide the retiree or the employee with notice every year that states whether or not that coverage is credible for Medicare purposes. And that's something that they have to provide to you annually, as long as they're providing you some sort of other coverage. And that letter tells you whether or not that drug coverage is considered credible as compared to Medicare Part D or not. If the drug coverage that your employer is offering is not considered credible, then you would certainly want to look at getting a Medicare Part D so that you have drug coverage and so that you're not penalized for not getting a Part D sooner. Out-of-pocket costs obviously are going to be the biggest factor for most people. Some employer retirement plans can be very, 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 very good for very little cost. Other employer plans, maybe not so much. And then there's always the possibility that the employer at some point down the road decides to stop offering retirement health benefits to their retirees. I've seen that happen over the 20 years I've been doing this. I've seen companies as big as, major car manufacturers stop providing retiree health coverage to their retirees. So it's nice to have that benefit offered to you, and it's certainly worth considering when you're looking at your options. And many times it would hopefully be a better option than having the standardized options that we talked about before. But the bottom line is there's never any guarantee that that coverage will last forever from the employer. Even for federal retirees these days, there's never any guarantee that the federal government will be able to offer or continue to offer retirement health benefits to retirees with Medicare. On the plus side, if that were to ever happen, so if you enrolled in retiree health coverage and at some point down the road, the employer chose to stop offering that coverage for retirees for some reason, it would put you in a situation that we've talked about before, loss of coverage, not of your fault. It'd be considered involuntary loss of coverage, and it would provide opportunities for you to get into the other standardized options, such as a supplement or a Medicare Advantage plan, without penalty. It would be a special enrollment and guarantee issue based on the loss of other credible coverage, because retiree coverage that's secondary to Medicare is considered credible if you lose it involuntarily. But again, you're going to want to compare costs of having that retirement option versus the cost of just going straight out and buying a standardized supplement or a Medicare Advantage plan. If you know that your employer is going to offer retiree health benefits, make sure that you contact your Human Resources Department to get specific information about those benefits. We are happy to help people review benefits that are being offered to them through the employers and help them understand the differences and the comparisons between the other options. At our office, we are trained to do that. So if anybody had any questions or wanted some more information, we're happy to help with that in that regards. Again, you're going to want to consider the pros and cons. And a lot of times it's totally up to the employer as to what's going to be offered, how much it's going to cost you, and what kind of coverage it's going to be. But always suggested and recommended that you review that option before you make a decision about what kind of coverage you will get. Any questions about any of that? I know there are some retiree groups in this area in particular, such as PERA retirees or federal employees that are retired, that are offered very good options. And certainly I strongly encourage those retirees to look at those options before they decide not to use them. But when it comes to the smaller employers or the more private employers, options can vary quite a bit. So I'm not seeing any questions in the chat box. I'm not hearing any questions on the open mic, so we will move on. And so let's talk about retired military and veterans. So obviously in Colorado Springs area, we are surrounded by military bases. So we do tend to have a lot of military retirees in our area, which is wonderful. And as a military retiree, you quite honestly are going to have one of the best options available to anybody in this country for coverage to go with your Medicare. For a retired military person, whether you are currently covered under the military coverage of TriCare or not, when you become eligible for Medicare, you will have the opportunity to enroll in TriCare for Life. If you are currently enrolled in a TriCare option, be it standard or prime, before Medicare eligibility, when you become eligible and enrolled in Medicare, that TriCare prime or standard changes automatically to TriCare for Life, and it becomes secondary to Medicare and basically works like a Medicare supplement with drug coverage. And honestly, again, it is literally considered the best available coverage for anybody to go with Medicare. In order to qualify for TriCare and TriCare for Life, you would have had to have served at least 20 plus years in the military and be honorably discharged and retired. When you become eligible for Medicare, whether it's based on turning 65 or even based on being on Social Security disability, as soon as you become eligible for Medicare, you need to enroll in Medicare. That is one of the biggest things about TriCare, is that when you become eligible for Medicare, you are required to enroll in Medicare. Even if you are actively employed with another employer and have employer group coverage, they are still going to require you enroll in Medicare in order to be able to keep your TriCare. At that point, because you will have TriCare once you've enrolled in Medicare, and that TriCare will turn into TriCare for Life, you will not need to enroll in a separate drug plan through Medicare, because TriCare includes drug coverage that's considered very credible. You honestly will not need to look at any other kind of coverage to go with Medicare, because again, TriCare for Life and Medicare are considered the best coverage combination available in this country right now. You will have to contact your local DARES office when you become eligible for Medicare to let them know that you've enrolled in Medicare and give them your Medicare number so that they can trigger that TriCare standard or prime to turn into TriCare for Life. You can get more information by going to the website listed at the bottom of the slide. The TriCare website actually has a lot of really good information on Medicare and TriCare and how they coordinate or how they don't coordinate, and when and where you can use it. So real quick, let me address the question that Kaylin had about TriCare. So currently on TriCare, I can tell you that Medicare typically does cover insulin pumps for diabetics. As far as the specific types of sensors, if that is a specific brand, it should be covered by Medicare as a type of product. but you might have to do some looking around for providers who bill Medicare that offer that particular brand of product. And that would be something that you would talk to Medicare directly about as far as coverage. Yeah, not Social Security, because once somebody is enrolled in Medicare, Social Security doesn't want anything to do with Medicare. They determine your eligibility, they enroll you in Medicare, they give you the Medicare card, and then they're done with you. They cannot answer Medicare questions of any kind, and they'll refer you to the 1-800-Medicare number. Or, of course, you're always welcome to call us, your local SHIP office, and that's what we're here for, is to help you answer those kinds of questions. Yes, I will give you the number to the local Social Security office at the end of the presentation. Don't let me forget. All right, so again, retired military, take advantage of TriCare for Life. You earn that benefit. You're entitled to that benefit. It costs nothing to you to have that benefit, and it is considered extremely good coverage to go with Medicare. If you're a veteran, but not retired military, you may still be able to access VA benefits. To be eligible for access to VA benefits, eligibility is, of course, determined by the Veterans Administration. It can be based on disability, it could be income-based, or it could be medical need-based. If you're determined eligible for VA benefits, it gives you access to the VA medical services and facilities. When you become eligible for Medicare, if you are using or accessing VA benefits, and we do have several clients who want or have always used VA facilities and benefits as their primary health care, and they always ask when they become eligible for Medicare if they should enroll in Medicare, if they need to enroll in Medicare. And what people need to understand is that Medicare and VA do not mix. They do not coordinate. They do not work with each other. They do not supplement one another. Medicare enrollment, when someone becomes eligible for Medicare, is a voluntary thing under any circumstance. There is nothing anywhere in the laws and rules and regulations of this country that says you have to enroll in Medicare. And so for people who prefer to access VA services, no, you do not have to enroll in Medicare. However, there are advantages to enrolling in Medicare. When you use the VA system, you are limited to the VA facilities. The services that you receive may be limited based on your eligibility. Costs may be incurred based on income related eligibility. If you were to enroll in Medicare in addition to accessing the VA services, it would give you the additional freedom of choice to receive medical care for any reason whatsoever, anywhere, at any time, without question. So while the VA system can be very wonderful for many people, it can have its barriers as far as access, as far as availability. I know I have some clients who live way, way out in the middle of nowhere and have to drive several hours to get to the closest VA facility. When if they had Medicare in that situation or went ahead and enrolled in Medicare in that situation, they would be able to access the doctor 20 miles away instead of 2 hours away. Medicare does not care why you need medical services, as long as those services are necessary. So as long as you can find a Medicare provider for any reason, based on medical necessity, anywhere, Medicare will cover those services, where of course VA can be a little more limited. So there are benefits to having both. There are absolutely benefits to having both, but Medicare is not required by anybody to enroll in. So there are people who choose not to enroll in Medicare. VA service or VA access is not considered credible coverage. So if you choose not to enroll in Medicare when you first become eligible because you use the VA system, you would be allowed to enroll in Medicare down the road during a general enrollment period, but you would be penalized for not having enrolled sooner. So again, it's not considered credible or a good enough reason to delay enrollment into Medicare. So keep that in mind. You would be able to enroll later, but it would cost you more. And of course, having access to the VA system obviously provides some additional benefits, can provide some access to long-term care services and supports, pension benefits, all that kind of stuff. So there's pros and cons to all things in all regards of life, usually. But there are definitely some benefits to enrolling in Medicare if you have exclusively used the VA system in the past. It can provide some good benefit, but you do have to pay the premium. And that's usually the downside. Any questions about either TriCare or VA? Must not be to the part people want to hear about yet. So I'm not seeing any questions in the chat box. I'm not hearing anybody unmute, so we will move on. All right, so Medicaid. We're going to talk about Medicaid next. Medicaid is an option for people who may have limited or low income. Medicaid, the Medicaid program itself, is a state-run program that is funded by both federal and state dollars. And it's typically considered what's called a needs-based program, meaning you have to be eligible to access that benefit. In Colorado, our Medicaid system is called Health First. I've provided a link to the Health First website. What many people don't understand about Medicaid is that in Colorado alone, there are probably about 45 different kinds of Medicaid available. And each one of those 45 programs of Medicaid probably have different eligibility criteria to qualify. Many people may be familiar with what in the business, I guess, is referred to as Magi Medicaid, also known as the Medicaid or expanded Medicaid through the Affordable Care Act. Magi Medicaid is the Medicaid program that's available to most people under 65 who fall within a certain income range. Their income is at a certain level or less. For that particular Medicaid program, as long as you meet the income eligibility criteria, that program does not look at assets. So if you have a 401k, if you have investments that you just get distributions from, you inherit money, those kinds of assets are not taken into consideration for eligibility into expanded Medicaid, only monthly income. And I can tell you it has been a lifesaver for many, many residents in Colorado. And that is the newest benefit of Medicaid. That's the new expanded benefit of Medicaid, again, based on the Affordable Care Act. But again, in Colorado, we have many, many kinds of Medicaid. Medicaid programs vary by state. Colorado, honestly, is a pretty generous state when it comes to Medicaid, but there are many, many states in this country that are not quite so generous. And I don't know if anybody watches the news these days. I try not to. Some states are very, very not generous about their Medicaid program. So programs can vary from state to state, and each state for the programs that they do offer can have different eligibility criteria. Primarily, a Medicaid benefit is going to be based on income. It's going to be based on financial eligibility as the first criteria, and then perhaps medical eligibility or medical need as a second criteria. Regardless, Medicaid will always consider themselves the payer of last resort. So if you have employer coverage, but you also qualify for Medicaid, the employer coverage is always going to be primary. If you have Medicare and also qualify for Medicaid, Medicaid will always be secondary or last after Medicare. So it's always going to be the coverage of last resort or payer of last resort, regardless of what other options might be available to somebody for health coverage. There are programs that are designed specifically for people who become eligible and enrolled in Medicare. And those are called Medicare savings programs. I have mentioned them before. Medicare savings programs are technically not Medicaid because they're a federally funded benefit. But the way the government has chosen to manage that program or that benefit, that financial assistance is through the states, each state's local Medicaid system. So even though technically it isn't Medicaid, it is still something you have to apply for through the Medicaid office or the Department of Human Services. But it's designed only to cover Medicare related expenses. So most Medicare savings program benefit is going to pay the Part B premium. If you're at the lowest income asset level, it may not only pay the premium, but it may pay your Medicare A and B deductibles and your co-insurances. But it's only going to cover Medicare related expenses. Other programs that might be available to people who are aged or people who have disability. In Colorado specifically, we have a few programs, the old age pension, which I really hope they rename one of these days because it's not a very complimentary name for a program, but it's a program that provides actual monthly cash benefit that could potentially supplement Social Security. Medicaid is the primary benefit or primary payer in the country for most long-term care needs for people, and that's nationwide. And that's whether or regardless of whether or not that home care or long-term care need is based on receiving services at home, going into a assisted living facility or a long-term nursing home. So Medicaid eligibility, again, different programs are going to have different criteria, but all of that criteria is first and foremost going to be based on income and assets. For Medicare related programs or any program that someone who is 65 or older or is eligible for Medicare is always going to be income and asset based. So you have to be within certain income limits. You have to be within certain asset limits in order to qualify for those benefits. Medicare savings programs, which we have talked about a couple of times in the past few weeks. Again, income and asset limits are just that, limits. And if you are even $1 over those limits, then you're not going to qualify for that assistance. For people who are perhaps looking at long-term care needs under Medicaid down the road, those income limits are much higher than the Medicare savings, but the asset limits are much lower. But the benefit of qualifying for that assistance is that it does provide that much needed long-term care, again, whether it's at home or in a facility, because the cost of those services can be quite high. So again, Medicaid, especially in Colorado, tends to be rather generous than many other states in the country. And the criteria will vary from state to state. So you need to be aware of that. And anytime anybody has any questions about Medicaid programs at all, or is looking for assistance, or perhaps trying to determine if they're eligible for any of these programs, you're welcome to give us a call. We always help with that kind of benefit, either helping you determine eligibility. We also help with applications. And so we're happy to do that. Give us a call, shoot us an email. Any questions about any of that so far? Well, you guys are hanging in there, but I'm not getting any questions from you. All right. We will move on to marketplace coverage. Again, marketplace coverage is a result of the Affordable Care Act. A lot of people refer to it as Obamacare. Marketplace coverage is basically a private health insurance marketplace. It's a federally mandated benefit based on that Affordable Care Act. Colorado is one of the few states that actually manages its own marketplace versus letting the federal government do it.
Hey, I do have a question on the previous slide.
Sure.
I just couldn't type fast enough. So basically, if I read this right, as we get older and we live to be 110, we basically use up all of our money, and then Medicaid pays for the nursing home until we die.
Possibly, yeah.
That's
And that's just the point of the Medicaid system in that regards, is it's because it's always going to be considered the payer of last resort. It's primarily going to have the expectation that you have exhausted all of the resources before you are eligible to access that assistance.
Even inheritance and all that.
and what about inheritances and stuff like that? Is that, I mean, part of that?
All resources.
All
So we
resources.
look at any and all financial assets of any kind, whether you get them before, after, or otherwise. They are always going to look at those resources.
So they probably do a lot of checking to make sure you're not hiding, $1 million in the Cayman Islands and stuff like that then.
The initial application can be kind of lengthy so that they are able to look at those kinds of things. And they really aren't going to look, honestly. They're not going to go searching for foreign bank accounts. What they look at initially is the information that you provide to them. And they may look at like bank accounts.
Okay,
Dig into bank accounts a little deeper. They may go back 5 or 6 or 7 years in
okay.
account histories, just to try and determine if at some point in the recent past, maybe there was $100,000 in the bank and suddenly from one month to the next, it was gone.
Yep. Okay.
That would obviously be a red flag.
We've heard stories, and I'm not going to.
I'm sure everybody has. And, to be honest, back in the day, those stories were probably pretty credible. These days, not so much. They really are much better at what they do and don't do and what they can and can't do. And there's a lot of misconceptions about the Medicaid system, especially when it comes to long-term care. So again, if anybody has any questions or concerns or just wants to make sure that they're understanding how it works correctly, give us a call, shoot me an email. Because certainly we have spent plenty of time in the Medicaid system and helping people through that process that, we pretty much are going to be your best resource for explaining those kinds of things. And we'll be willing to take the time to do that for you.
And if anybody needs help hiding money, we can be the recipient of that if anybody needs some help along the way.
I wasn't going to say that, but I'm open. We're not for profit.
Thank you. I'm going to be quiet before I get in trouble.
If you bury it in the mattress or in the backyard, there's no proof it's there. What can I say?
Thank you, Roma.
You're welcome.
I always have to be funny.
Any other coverage or any other questions? Sorry. All right, so marketplace. Again, federally mandated. Marketplace, and again, if you've watched the news recently, the president has extended the enrollment period this year for marketplace due to COVID and some other factors, and has extended or enhanced the credits, the tax credits and subsidies available to purchase marketplace coverage. Marketplace coverage is basically coverage that is available to anybody without other options. So you may be employed, but the employer doesn't offer health insurance. That employment makes your income too high to qualify for Medicaid. You're not employed or you're self-employed. You can now go to the marketplace and get insurance regardless of pre-existing health issues, where prior to the Affordable Care Act, that wouldn't have been possible. And with the government subsidies of the premiums and tax credits, it can be very, very affordable. And with the recent extension or enhancement of those tax credits, Right now is really a good time to buy marketplace coverage if that's something that you're eligible for and if that's something that you need. There are typically annual enrollment periods that kind of coincide with everybody else's enrollment period. But again, right now that enrollment period is extended to at least the end of May, and it may have been extended a little further. I can't remember if I read something in that regards or not, but I know it's extended at least till the end of May. There are many companies that offer marketplace coverage, offer different levels of coverage at different pricing. And you'd be able to go to the Connect for Health Colorado website and actually look at the different options available and the costs. And it will show you the copays, the deductibles, the maximum out-of-pocket costs, all of that kind of stuff that the insurance companies, whether it's an HMO or a PPO. So that website can provide a lot of good information for shopping around for that kind of coverage. And again, right now is a good time to get it simply because tax credits have been enhanced. And I know I saw a commercial on TV just last night, I think, that showed that you can get a marketplace coverage if you qualify for the credits for as little as $10 a month or $50 a month. So very, very affordable right now for those who qualify. And I don't remember if they have done away with the penalty, the tax penalty that you have to pay for not having health insurance coverage or getting marketplace coverage. But certainly another viable option for people without other options. Now, marketplace coverage does not coordinate or work at all with Medicare. This would be an option instead of Medicare. So if you've been on marketplace coverage or if you have marketplace coverage for any reason and you become eligible for Medicare, you're going to drop marketplace coverage and enroll in Medicare. And there's benefits to doing that for a couple of reasons. Obviously, the first one is going to be cost. Medicare is going to cost much less than marketplace coverage for most people. But you also can't have marketplace coverage and Medicare at the same time in most situations. There are some exceptions to that rule. And those people, there are people who have honestly called and asked if they had to enroll in Medicare because they wanted to stay on marketplace coverage for whatever reason. Now you can be entitled to Medicare and stay in marketplace coverage versus Medicare, but you wouldn't qualify for any of the tax credits or premium subsidies. And if you were receiving those, you would lose them if you chose not to enroll in Medicare and stayed on marketplace. But it's also illegal for a sales agent who knows you have Medicare to try and sell you a marketplace policy. If you are not eligible for Medicare, or if you're not eligible for premium-free Part A, meaning you'd have to pay a premium for both Part A and Part B of Medicare for whatever reason, you can choose not to enroll in Medicare because you would have to pay a premium for Part A in favor of marketplace. Now, the caveat to that is if you choose not to enroll in Medicare, you also cannot collect Social Security income. So eligibility for Part A, especially free Part A, is absolutely tied to your ability to collect Social Security income. So if you choose not to enroll in Medicare Part A when it's available to you at no cost, you're also choosing not to collect Social Security income. You can't have one without the other. But if it's a situation where you have to pay for Part A, you would be allowed to get marketplace instead. If you choose to stay in marketplace or keep marketplace instead of enrolling in Medicare when you become eligible, again, you would be able to enroll in Medicare down the road, but you would pay a higher premium for it because it's not considered credible coverage for the purpose of delaying enrollment into Medicare. Now, if you have Medicare, you can still go on the marketplace and look at dental coverage. So you can buy separate dental or vision plans through the marketplace with Medicare. And for many people, that's a good option to look at if you're looking for actual dental insurance. Most dental insurance these days is pretty standard, regardless of where you get it from, honestly. you're looking at a premium of $30 or $40. You're looking at an annual dental benefit of, anywhere from $1,500 to $3,000 and maybe more. But it's a good place to look for that kind of coverage, and you can compare different coverage options. Again, as with most types of other coverage, because this is a federally mandated benefit, rules and laws can be kind of complicated. Again, I did provide a handout in the email I sent earlier that provides some frequently asked questions and information on how to get more questions answered or find more information. I do have a question in the chat box. Can Obamacare discriminate about pre-existing conditions? So that, again, that was one of the biggest benefits of the Affordable Care Act and everything that came with it, is that it eliminated the insurance company's ability to deny coverage to anybody based on pre-existing health concerns. So the answer is no, they cannot look at your pre-existing health issues and deny coverage, increase premiums for coverage, limit the coverage that they offer under any circumstance. The Affordable Care Act basically eliminated the ability for insurance companies to pre-screen or limit coverage under any circumstances based on pre-existing health issues. And hopefully that will stay. Again, the rules are different from Medicare related products. As we talked about in week 2, there are some situations where Medicare supplements are allowed to look at pre-existing health conditions. But these days, that's pretty much one of the few situations where pre-existing conditions can ever be considered. Any questions about any of that? Well, I think that was everything. I think that's all the other options that we were going to talk about tonight. Again, I appreciate everyone who has attended this presentation and these 4 weeks and hung in there with us. Hopefully you found these presentations helpful and informative. And again, you're always welcome to give us a call or shoot us an email if you do have any additional questions in the future, or if there's anything we can assist you with down the road regarding your Medicare. You're always welcome to reach out to us during the annual open enrollment periods so that we can help you review your options from year to year. We're happy to do that as well. Contact information on the slide. Again, I provided our local number, my email address, as well as the statewide toll-free number that will route somebody to the SHIP office closest to them anywhere in Colorado. Again, every state has access to SHIP counseling, at the very least through a statewide toll-free number. And we do have a listing of the toll-free numbers for SHIP programs in any other state if anybody's interested in that. So I thank you all for your attendance and your attention. And we hope that you enjoyed this presentation. If there's anything else we can do, please let us know.